Hi everyone, I'm Janet from Cytohealth. Today we are very happy to have Dr. Chua in this short interview video for the topic of the autism. Dr. Chua, can you please introduce yourself?
Hi, I'm Dr. Chua from Gleneagles. I'm a consultant Anaesthetist and Critical Care, and I've been practicing in this hospital for about 25 years, especially in regenerative medicine for the last 20 years.
So Dr. Chua, let's start with our very first question. People with autism will also be described as people on the spectrum. Can you please describe about what is autism, also called Autism Spectrum Disorder, to our audience?
ASD or Autism Spectrum Disorder can be very simply defined as a neurodevelopmental disorder which is defined by persistent deficits in social communication and social interaction. This is accompanied by very restricted, repetitive patterns of behaviors, interests, or activities in the child. The word spectrum basically means there's a wide range of symptoms or severity of that condition, just like the light spectrum or the electromagnetic spectrum, beginning from very mild condition to a very severe condition. And hence the word spectrum is part of the diagnosis.
So doctor, since you have many years of experience in autism, could you please share some of your experience about when you're dealing with the autistic cases?
My first introduction to autism or ASD was when I watched the movie Rain Man. The main actor was Dustin Hoffman. It really showed me what autism was about. My second introduction was when I was presented with autistic kids coming for anesthesia or surgery, and I realized how difficult it was for the family to have autistic kids. Since ASD is a spectrum, I've seen very mild conditions of autism and also to the extreme ends of autism. And it can be very distressing for the whole family when you have a kid who is severely autistic. For a family with severely autistic kids, their life has actually not been normal at all, to the extent that the mom and dad will find that their daily lives are disrupted. Nothing can prepare them for what is ahead of them. For example, one of the parents may have to give up the job just to look after one child, which is normally the first child. If the first child is autistic, usually the family would have decided not to have another one because autism runs in the family. So it's possible to have the second or even a third child being autistic to the same extent, and hence this traumatic experience would be, I would say, much more lightened if there are proper treatments, proven or unproven, and also new modalities of treatment that can come in to hopefully improve on the situation for the family. Now, we must realize that the diagnosis of one child can affect the lives of everyone in the family. So improving one person's life, which is the autistic child, can improve everyone's life, especially the parents and even the grandparents.
Doctor, before we moving to the treatment and diagnosis questions, what are the possible causes of autism?
Okay, there are a lot of research being done now with regards to the cause of or etiology of autism, because the incidence is actually getting more and more common. In about 5 or 6 years ago, the CDC of America have stated that the incidence is about 1 in 55. But in the last 2 or 3 years, the incidence has actually increased to 1 in about 44. So that means the incidence of autism is going to be increasing, which means we are going to see more and more of this kind of autistic kids in the future. What are the possible causes? Well, they are still looking into, basically the main causes are genetic mutations. That means all this happening actually starts very early in life, even before the child is born. And this could be contribution from both the mother and the father, because these are what they have found, that the genes are the ones that are faulty. Other possible contributions can happen later on, like infections when the child is in the womb, or environment like pollution and heavy metal toxicities. All this can perhaps contribute to the development of autism in the offspring. At the moment, the consensus is there is no cure for autism, but with early intervention, early diagnosis and intervention, there is a great possibility that we can improve on the child's condition and make him more independent in the future. Totally.
Cytohealth.